I think the question that a lot of folks have on their mind, and some of the things that I've seen in videos on social media, is okay, I understood we had this happen in the past. You have slavery, you have redlining, you have Jim Crow, you have all these things. Why does this persist into 2020? And then on the back of that, what has not been done and what could be done on that part of governments, businesses, on the part of us as people and as Americans to change some of these outcomes, because this story has been the same for so long.
I think what I would say, just as a way of trying to reduce all the complexity and all of the issues that I've described, is to say that what we have come to understand more than anything else is that there are persistent sources of disadvantage that are a part of being a member of a minority group in the United States. Uh, we are just a nation that sorts our populations into haves and have-nots. In a setting where that sorting of haves and have-nots is a function of what group you're a part of, what race you belong to, part of what we do is say, can we develop health policies that are race-free, where somehow or other your being in a group that has historically had disadvantage doesn't allow us to continue to use policies that fail to confront that disadvantage and try their best to do something about them. I think we're in a setting now where everybody is suffering as a result of COVID-19. So while it is the case that the greatest level of suffering has been in poor communities of color, what we've also learned is that their suffering is not independent of what happens in the mainstream. If COVID-19 could fell the Prime Minister of England, what we learned is that we are all at risk. And the notion that just because some populations are contained doesn't mean that a virus like COVID-19 is confined. It gets out. So we have created all sorts of reservoirs of infection that are often determined by race, ethnicity, that now have the capacity to threaten everybody. Being in a well-proportioned, well-put together neighborhood does not spare you from being exposed to and infected by this virus, which suggests that the way in which to keep all of us safe is to make sure that we eliminate the factors that create these pools of infection. We become really clear that the only way we're going to survive is if we're all on the same level playing field. I would like to believe that the motivation to escape the trauma and the devastation of COVID-19 will have us rethink the ways in which society is organized. We'll understand that creating and leaving untreated pockets of poverty is also a way of creating and putting in place reservoirs of potential infection that can, in a pandemic like the one we're going through right now, come back to haunt us all.